Hi everyone, I am Kimberly, the 5-Minute NP. The 5-Minute NP was born out of my belief that small, incremental changes can drastically change the trajectory of your life. Our genes do not have to determine our lifespan. My goal through this podcast is to act as a roadmap that bridges the gap between knowledge and action, leading to you living your healthiest, happiest, longest life. Welcome to the 5-Minute NP podcast. Hello everyone, welcome to the podcast. It was an honor to interview Dr. Stasha Gominak on this episode. She is a neurologist who left her practice to devote herself solely to helping people sleep. Once she discovered that a majority of her patients' headaches, joint pains, sleep disorders, and other neurological illnesses were associated with low vitamin D, vitamin B, and the microbiome, she knew she could improve people's health and their lives just by improving their sleep. She found that vitamin D is way more than a vitamin. It is a hormone, which means it affects multiple parts of our body functions, and our immune system. And shockingly, low vitamin D has been associated with poor sleep and memory problems, weight gain and appetite, high blood pressure and cardiovascular disease, reproductive and fertility problems, autoimmune diseases and cancer, our bones, ADHD, and autism in kids. She has developed the Sleep Right program, a way to see your doctor once a year, but heal your body every night. She is one of the smartest people I have interviewed, and the information she provides is invaluable. Listen as she explains the correlation between vitamin D, vitamin B, and the microbiome as it relates to sleep loss and disease. Welcome to the 5-Minute NP podcast. First of all, thank you, Dr. Gominak, for being on today.
Thank you very much, Kimberly, for inviting me. It's my pleasure.
Yeah, it's funny because how I found you, I was doing some research on vitamin D as it relates to COVID. And then I just happened to stumble on an interview you were having on high intensity health like years ago. And I just started listening to your interview, and it was all about vitamin D, but as it relates to sleep disorders and other neurological problems and just all this correlation with vitamin D. And I was like, wow, people need to hear this. This is really important stuff.
Yeah, the tragedy of COVID has put vitamin D on the front page. So it's improved my business a lot. In fact, Mike Mazzell did a second run through another interview where we concentrated more on COVID. So that he just put that up on his site. So I recommend that to you.
Yeah, I actually watched it. It was really good too.
Oh, good.
I've been listening. So that's why I'm really excited to share this information. And I know we have a lot to unpack here, but I just want to give a little bit of background on you. You were a practicing neurologist for many years, right? Before leaving your practice to focus solely on sleep, improving neurological disorders through improving sleep. Is that right?
That's right. And I was not really trained in sleep. Most of us doctors were trained to avoid the conversation because that usually meant we were going to have to get to sleeping pills, and we were trained not to do that. So I got to it in sort of a back way, and I'm happy to talk about that. Would you like me to jump right into that?
Yeah, I wanted to see, like, you mentioned sleeping pills, and it's so prevalent, and people kind of see that as a sign of weakness, but it's really not. There's I think at one point, I think we're going to get into that a little bit about how we can use those properly while we're, stabilizing things. But what disorders were you seeing? Like what got your interest in sleep?
So this started with a headache patient. So about half of my practice were daily headache patients, and they are miserable. They have a headache every day. They also have migraine. In my view, they're all the same. All the headaches are the same. They come in more severe forms and less severe forms, but they're all miserable. And I've been, doing headaches, treating them as a neurologist with some success, but it's never really stays. So even if you find a medicine that works, 2 or 3 years later, they're back, they've gained 20 pounds and their headaches are back. Very discouraging. And there's a huge literature now about the genetics of migraine. So if this is a genetic thing, then why would it get worse? Like, why would it not be there at age 25? Why would it be there at age 35? So there's still a lot of questions left. And one of my patients in about 2005 said, okay, I've done these 4 medicines that you've had me do over a couple of years. My headaches are no better, and I want a sleep study because my husband says I snore like a train. And I said, I don't know anything about that. I'm not going to do a sleep study. And she said, I want you to do one. I said, okay. I mean, I don't know what to do about it because I hadn't, plus, no one had said anything about young, healthy females having headaches because of a sleep disorder. She turned out to have sleep apnea. She had a CPAP device given to her by the person who read it, the pulmonologist, the lung doctor. And she comes back a couple months later, her headaches are gone. And I thought, wow, this is totally unbelievable because that's a torture device. She can't even put her hair in a ponytail. It hurts to touch her head. How would that have a placebo effect? There's no way. There's not a big line of people out there saying, give me that sexy thing. I want to put it on at night, you know? So the fact, and I've been with her for 2 years. We tried all these medicines. This has to be something. And how would that work exactly? So that thing's blowing air up in her nose. How would that make her headache go away? So I'm struggling with that. And then I start to do sleep studies in all my headache patients because they're all pretty desperate. I mean, we have partial success. It's not that the medicines don't work at all, but all of them are pretty willing to do anything. And they're all tired. Once you open up that door and say, oh, should I ask about how their sleep is? Well, I never have because they have 2 little kids. They have 2 little kids who didn't sleep themselves. They're 5 years sleep deprived over those 2 kids. And they say, I'm tired. And we as the physician look at them and go, you have 2 little kids. What the hell do you expect? You know, we would minimize their complaints saying they had a perfectly good reason. But in actual fact, they're telling us something really, really important. And in retrospect, there were lots of times that my headache patients were telling me things like, I wake up at 3 a.m. with a headache. Or if I sleep in too late on a weekend, I get a headache. If I nap, I get a headache. I had no framework in which to understand the significance of that. So I was like, okay, that's interesting. So what happened then was most of my patients who I sent for sleep studies did not have sleep apnea. So what do I do then? So this is at the very beginning of really, for the first time, I'm sending young, healthy females, teenagers, little kids for sleep studies. And I'm sending a whole bunch of them, like 1,000 over 2 or 3 years. Wow. And the pulmonologist finally gets back to me and says, you know, I don't know if you've noticed this, but your population is really different than the people we usually see. And your patients have REM-related apnea. Mm. And I was like, well, what does that mean? He said, oh, they only stop breathing in REM. I said, well, it doesn't say that on the front page. No, we average it out over the whole night. So if you have only a half an hour of REM, you're supposed to have an hour and a half. But you have a half hour and you stop breathing 8 times, which means in that half hour, and if we do sleep in blocks of time, it makes you think that we're doing something. We're doing something that needs, and you know, maybe at least 30 minutes straight, and we're interrupting it every 5 minutes. That might suggest that you're not getting the work done that you're supposed to. So she stops breathing 8 times. The report, the first page says, no significant apnea because they've averaged it over the 8 hours that she slept. So that's 1 time per hour. Well, that's really not relevant when the patient is really tired. She sleeps, but she feels tired all the time. So she's getting into these deeper phases, but they're interrupted. And then the other thing he points out is a lot of your patients don't have any REM sleep. And the same thing, well, why isn't that on the report? I'm reading the front page. So I learn I have to read all the rest of it. And the reason why it's not on the front page is we don't know why. So as soon as I say, Mrs. Jones, you have no REM sleep, what would be the natural? Oh, could that be why I feel so tired and I can't remember anything? I'm in a bad mood. Well, yeah. And then what would I ask as the patient? Well, are you going to fix me? And nobody has a clue. Nobody's writing about this anywhere. So now I've got 1,000 sleep studies of young, healthy females, teenagers, and kids, and they're all abnormal, but it's usually not apnea. So now what do? Now I begin to see the patients who do have apnea do better because they can wear that mask thing. I don't really want to give it to them. But then I feel bad for the ones who don't have apnea. And what am I left with? Sleeping pills. And it turns out in retrospect, all of the medicines that we've used for years will make the headaches better when they make the sleep better. If they don't make the sleep better, then they don't usually make the headaches better. So I start to use sleeping pills with the concept that sleep is really the underlying disorder here. I happen to have sleep studies on people who think they're sleeping fine. So the little kids, 8-year-olds, they sleep for the full amount of time. They're tired in the morning, but when you actually look inside the phases of their sleep, the work phases are smaller. They have fewer minutes spent in these deeper work phases of sleep than they should have. Well, that's not supposed to happen. And this is happening now around the world. So if I'm seeing this, I don't think there's an epidemic in Tyler, Texas. I think there's an epidemic around the world. And I'm about to start writing about that. And I start to look into what are they saying in Brazil and in Germany and in Japan when they set up sleep study centers. Everybody's sleep study is abnormal. It doesn't matter why you're going there, it's abnormal. And that doesn't count all the ones that I won't send because they can't sleep at home. So if they have insomnia, when I say, well, why don't we do a supervised sleep study? My husband had one of those and he told me about all that stuff they put on you and it's in a foreign place. I'm not going there. I can't sleep at home. So that means we leave out half of them. And when you start thinking about that in a more general way, why would all these young, healthy people have a sleep disorder? And I really didn't have any ideas. I mean, we're taught that the environment is toxic and we don't eat right and all this. But it just seems to me that there's not enough of too much light and too much computer to make the actual brain function not be right. So there's got to be something else going on. So for 5 years, I'm doing CPAP and sleeping pills, which is extremely important because the people who could use CPAP absolutely got better. And then by about the 4th or 5th year, they're coming back saying, you know, I'm still wearing my CPAP, but I felt so good for the first year. And now I just don't feel very good. And I'm back on my blood pressure medicines. My diabetic medicines are coming back. So there's a clear connection between when we get to sleep better, many of the chronic illnesses get better with them. Then the question is, okay, does this mean that there is an illness in the background that then manifests with sleep apnea and we're addressing that by blowing air up the nose, but we're really not addressing the disease that's still getting worse in the background. So I've got my stroke patients that I see on the weekend who are sicker, but I've got 2 groups of patients who anything I come up with that makes their sleep better, it's still just a Band-Aid. It's a crutch. And then in the 5th year, an 18-year-old who had daily headache came in. I'm looking at her sleep study. She has 10 solid hours. She stays asleep, never wakes up to consciousness. And she thinks her sleep is fine. But she's coming back to discuss with me the fact that her headaches are better on this medicine I gave her, but she's still really, really tired. And her sleep study shows that she has no deep sleep. So what we do while we're sleeping is we go with light sleep and then a little light, little deeper, but light. And then we go into deep sleep. And when we get into deep sleep, we're paralyzed, which is kind of a freaky idea. You know, when the pulmonologist said, your patients have REM-related apnea, I said, well, what does that mean? And he says, well, we get the most paralyzed of all in rapid eye movement sleep. And I said, we get paralyzed? Isn't that kind of scary? I mean, why don't I just drown in my own spit? You know, that implies that we have to get paralyzed enough, but not too paralyzed. And clearly, even though we don't know why, there must be some reason why we get paralyzed. It would be very dangerous to be paralyzed when a lion is coming to eat you. So there has to be something about that is absolutely necessary for repair. So one of the other questions was, why do these young, healthy 32-year-olds have knee pain or back pain or ankle pain? Why do they have pain? They shouldn't have any pain. They're young. So not only do they have headaches, so at the same time, I'm looking at the sleep studies about what about these leg movements? Like the 2 things we record is there stopping breathing? Well, stopping breathing might suggest that you've got too paralyzed just for a little while. And you had to wake up to light sleep where you weren't paralyzed anymore. And then oh, they're kicking their legs too. Well, why do we count that? And what does that imply? Does that mean that when they can't keep their legs still during the paralyzed phase, that the repair of those parts is delayed or doesn't happen? So she's walking on her knees all day and then moving her legs, walking, and those movements are periodic limb movements of sleep. That means actually they're walking movements because we have this old walking nucleus in the part of the brain stem, the lower part of the brain that does paralysis. Right next to it is this other nucleus. So if you don't get it exactly right, you have these funny movements. In fact, women who have babies often have bunions, and bunions are from the toes moving like this. So that this joint here that's analogous on the foot, so it doesn't happen in their hands, but this joint is still moving because every kid they have uses up their chemistry, which we're going to talk about in a minute. So when you look at their sleep studies, if you put the recording device in the right place, you see their little toes are still moving. So there's a second question, which is, could physical pain be about not getting paralyzed correctly in deep sleep? So not only am I not repairing my brain by staying into these deeper phases, but there are parts of my body that I'm not repairing also. I've been struggling with that over time, but there are no answers in the literature. Now I've got this 18-year-old back to her again, where she has a sleep study that's got 10 hours of sleep. She does not get into any of the deeper phases where we get the work done. She has 35 times where she wakes to light sleep. So every few minutes, she tries to go into deep sleep and then boom, up to light, tries to go into deep sleep, up to light. So I'm looking at this sleep study going, this is tragic because she's going to be back here in 10 years with a stroke or something horrible. She is not healing her body at all. She looks perfectly normal. She has nothing else wrong with her. And she says, I'm so tired. And I say, well, did your doctor do your tired labs? And she says, no, I don't even know what that is. And I don't know what it is either. That's not my job. So I do a thyroid and a B12 level. She turns out to have a B12 deficiency. Because of that stuff about paralysis that I was telling you, I'm reading these nerdy articles about these single cells in the brain that are pacemakers that fire at a certain rate your whole life, just like the pacemakers in the heart. They keep time. And they are the ones that run the clock for the brain so that it knows it's 10 o'clock. So they're firing like this. And I'm thinking, I've been reading these nerdy articles where we're looking at these single cells. And so for the very first time, I'm thinking about sleep in a single cell. So I think, well, B12, I don't even know what that does, but I know you need it to have a normal cell to repair itself. So could this be a deficiency state? What if they're deficient in something? We could give that back. That would be a miracle. So I start to do B12 levels on all of my patients who have daily headache, who have sleep studies on. And some of them have B12 deficiency, but not all of them. The sickest of the sick have a B12 deficiency too. But one of my patients says to me, my doctor did my vitamin D level and it was low and she gave me vitamin D and my wrist pain went away. So I added on the vitamin D just because I was drawing blood. And within about 4 months, it's clear that every single person who has a wrong kind of sleep on their study also has a low vitamin D. Now, that in and of itself is not that exciting because everybody's D is low. But what happens is about the 5th month of doing that, I've been writing everybody little lab slips saying, take vitamin D. And I'm doing exactly what the FDA says, or the NIH says, 1,000 international units. And right before the Christmas break, 2 guys come back and say, hey, I'm still wearing my CPAP, but you promised me that it would take my headaches away, and it did not. But you sent me that little note about the vitamin D, and I started taking that, and within about 3 weeks, I slept better and my headaches went away. 2 guys said that to me in the same circumstance. They're both using CPAP. Within a week, I was like, whoa, why would that have anything to do with sleep? That doesn't make any sense. I don't know anything about it, and I'm not interested in vitamins. But over the Christmas break, I go to the literature, and there is nothing, when I'm using the search engine of the NIH, there's nothing about vitamin D and sleep at that time. But if you look at vitamin D in the brain, these same areas that run our sleep and our ability to get paralyzed, here's a guy writing about the fact that there are vitamin D receptors all over these cells that run our sleep. back in the 80s. I'm like, this is weird. Like, why would they be there? And he has this entire conceptual framework about how vitamin D is designed to make us be able to adapt to an environment where sometimes you're in an environment where it's winter and then summer. And in the summer, you need a different metabolism. And you'd like to link your fertility and your metabolism and your sleep to whether or not there's food or not. So in the winter, you sleep more, you hibernate. He's got this all written down starting in the 1980s. He made the entire framework. So I think, okay, I sleep great when I'm in Mexico on the beach. I wonder if there's a better vitamin D level that would mean that my patients would actually sleep better. Because I entered this completely naively, I know nothing about how controversial, how complicated, how scary vitamin D is. I enter it with this very simple question. All these people don't sleep well. I have their sleep studies. Let's send them down for a vitamin D level. Let's give them some vitamin D and see if they sleep better. And it wasn't that hard. In 6 months, it was like, how's your sleep? Terrible. Oh, bummer. Let's do a D level. And then bring it back. And what we find is you take 1,000 IUs, which is what the directed dose is, and they do the next level and it's lower than it was, which is weird. Like, what's up with that? And then we keep doing more D, and there's an awful lot to learn about it. But ultimately, when the D level got above 60, my patients slept better. So it was a very simple question. Can my patients sleep better with a certain vitamin D blood level? Luckily, my lab was using a very reliable test for D at that time. Also at that time, I knew very little about it. In the last 10 years, most of the labs have now reverted over to a cheaper, easier, but not accurate D level, which is a pity. So at the time, Walter Stump, who wrote about this conceptual framework of vitamin D, links us to the seasons. And I had called him and said, has anybody written about D and sleep? Because I just had this clinical observation that these two guys got better. And he said, no, nobody's written about that at all, but it makes perfect sense. I mean, they're writing those cells. That's what we wrote about. So he and I published an article in 2012 suggesting that the epidemic of sleep apnea and sleep disorders was related to vitamin D deficiency. Now, it is 2021. Soon it'll be 10 years after that. There are now a few sprinkles of articles. The hard part is you can look back and say everyone with sleep apnea has a low D, but so does everybody else. That makes it really hard. What you really want is to say, I have given vitamin D and I have gotten it to a certain blood level and I've fixed the sleep disorder. As a clinician, I saw that happen, but I could not convince my patients to go get another sleep study, a supervised sleep study, when they went to their deer lease without their CPAP device and their buddies did not bug them about their snoring this time. They're clearly better, but they say, I'm not paying $1,000 copay to have that stupid sleep study again. I feel great. Why would I? Okay. And the other stumbling block is all of the great big studies that take people and give them D, give them a specific dose. This is not a vitamin. You would never, what if I said, Kimberly, it sounds to me like your headaches are related to thyroid. I think you should go down to CVS and buy yourself some thyroid hormone. I'll see you back in a year. Right. I mean, even lay people would say, wait a minute, she's given her thyroid hormone and she's not checking her level. She's not adjusting the dose. Isn't there a process where too much and too little is both wrong? That is the case for every single hormone. Yet even really, really smart researchers who've been researching in D in a petri dish or in an animal don't really realize that you can't just say this is not a vitamin, but why don't you take 100,000 IUs once a month? It doesn't work that way. That is really dangerous. So I spent 2 years with more than 1,000 people doing D levels all the time. We definitely got better. It is a really important chemical to know about, but it is also very dangerous. The reason why I have a website is at the end of 2 years, everybody got better and then everybody got worse again. And their D was still perfect, 65. Mine still perfect at 65, but my sleep has gone to pot. Now I have peculiar pain that I can't explain. many of my patients are coming back saying, I came to see you for headaches. Now I ache all over. What's up? And because I'm doing something that's a little bit out of the usual, I'm also now taking responsibility and saying, I don't know what's caused this, but we're doing something unique here. And I'm a little uncomfortable that it's doing something else. Okay. So there were 3 things that did not get better with D, and these turned out to be really important. The first was the patients who are obese are usually obese because their D is low. We're going to talk about why in a minute. But they didn't lose weight. They felt better. They were walking at noon, but they didn't lose weight. So the D was about gaining weight. And it's really so you gain weight in the winter, so you have enough fat to last through the winter. That's what it was linked to. The second piece was the IBS that's there a third to a half of the time was not better. I never had IBS, but I was a little intolerant to garlic and onions, things like that. And that was not there my whole life. There was a particular time when that developed. And then the third thing was this pain that's unexplained. Okay, why is the pain worse now? So I'm stuck with that. I have 2 women that come in who have nothing to do with each other, except they both come to see me for headaches. They're both young, otherwise healthy, and they both come in there with burning in their hands and feet within a month of each other, which is really creepy. They have burning that sounds like a B vitamin thing. Like the neuropathy is my subspecialty. Burning frequently gets better with B12, but they were already on B12 because I've been starting anybody who was B12 low on B12. So I'm left with, I'm trying to avoid their question because I don't know why. I don't know what to do. And then a patient comes in with a book that is not about burning. It's really about this particular vitamin that makes rheumatoid arthritis better. And because I'm not that interested in that, and because I'm not interested in vitamins, I was a little resistant to it. But she brought it to me because the author says not only does their pain get better, but their sleep gets better. And there were references in that book to experiments done in the 1950s that actually blocked a vitamin called pantothenic acid, or B5. Because of those references that said when we block the B5, and this was a very small study in convicts in a very peculiar way that's not been repeated, they said within 2 weeks of blocking this particular B vitamin, they got a puppet-like gait, they had belly discomfort, they couldn't sleep, and they had burning in their hands and feet. So with that, I go to what the book says. I give my patients for only 1 week. I have this new reference and I say, look, anybody who has pain, who's been doing this vitamin D, we're going to do this other vitamin. I have gone to the health food store and I've picked up this stuff, pantothenic acid. And the bottle that's sitting on the shelf is 400 milligrams. And that's what the book says. Okay, so I'm proud of myself because I'm telling them the right thing to do. Also, while I'm there, I'm looking at all the B complexes. One, I don't know anything about vitamins, so I'm a little uncomfortable, but I'm looking for something that's dependable. So at least if I give a recommendation, when they go to the store, they can buy something that has the same dose. I don't know what the right dose is, but I think, okay, I find this B100. B100 has 100 milligrams of thiamine, 100 milligrams of riboflavin, 100 milligrams of niacin. It has all 8. The only thing I remembered about B vitamins was from medical school, if you give 1, you should give all 8. So by complete accident, I happen to do something that turns out to be pivotal, which is I give all 8 in big doses, and I give this 400 milligrams. Now, here's the problem. And by the end of the week, I have terrible restless legs. It starts in the morning and lasts all day. My restless legs is well treated, and it was at night. So I just took this stuff that has clearly ruined my sleep. And again, I think, I'm following what the book says, but like all the vitamin D literature, it's completely wrong, which is very demoralizing because these people are going to come back and say, what are you doing? I'm doing what the book says, but it's probably wrong and the dose is probably wrong. So I stopped the 400 milligrams of this B. I'm taking the B100 and my pain goes away in a day. Really weird. Then I have 3 months of these 40 patients trickling back. And so I stopped giving it out then because I was like really freaked out. My patients start coming back and they come back with this 400 milligrams. They go, are you trying to kill me? Were you trying to kill me? They were pissed off. I got so agitated and I couldn't sleep at all. So I only took it for 2 days. So Some of them fired me, but there were other ones who said, this 400 was terrible, but this B100, my pain went away in a day.
Wow.
I was like, that's what happened to me. What do you think happened there? That is so weird. Like, these are vitamins. They're supposed to be these innocent things that maybe help you, maybe not, okay? These are not acting like vitamins. They're acting like amphetamines. This is like going in and the people who came back all used the same phrasing. I was like, I don't know about this. They didn't write about this in the book. In the books, which I've been busily reading since I had this bad outcome, it says pantothenic acid deficiency doesn't exist because it's in every food. Well, I'm sorry, whatever this stuff is, it's in this bottle. It's not in any food. Otherwise, we'd never sleep. So at that point, I start to think, this is really weird. Why would my patients be so different in their response? Is there something that the D is doing that, one, the fact that I got so much better and that these other people got so much better when they stopped the 400 milligrams does suggest that what's happened over this 2 years that we're on D is we've developed a B vitamin deficiency state. This burning in the hands and feet is very, very typical. Mm-hmm. So the gals with the burning, both of them, their burning went away in 2 days. Both of them were really enthused about this big dose. But the rest of the people, obviously the dose is too big. Now, the first question is, these two women with the burning, they haven't changed their diet. If the vitamins come from the food, then why would they get a B deficiency? So I have this concept that the D is helping them sleep better, so they're making more repairs. So there's a concept that's not too weird that, okay, we use these B vitamins as building blocks for all the repairs that we do. Maybe they need more, but why would they become deficient? Well, in the background, I start to read articles about the B vitamins, and the first review that I look at says thiamine B1 has a food source and a colonic bacteria source, a poop bacteria source, and riboflavin the same, and niacin the same. And I'm like, wait a minute. It took me a couple times reading it, but I went, wait, all of these are made by the poop bacteria. Could it be that all these people with IBS have the wrong poop bacteria, and therefore their guys are not making these 8 chemicals that they need? Therefore, when we take away their B vitamin stores by making more repairs, they wind up with a B vitamin deficiency state. Now, here's the problem with that. How do we get them back? Like, we're trading recipes for probiotics. I'm on probiotics, they're on probiotics. We're all using that, yet apparently it hasn't worked. And the next question was, I was really convinced by Walter Stump's material that D should have an effect on the microbiome. So it makes perfect sense to think we gain weight because we get a different set of poop bacteria and we lose. But I've been doing D for 2 years and their poop bacteria did not get better. That is what makes this stuff dangerous. So one of the struggles was to try to figure out, if the B vitamins looked like they had become deficient as well, why would that be? And ultimately, the final answer is the B vitamins always came from the bacteria in our gut. When the D went low, those bacteria that needed D went away. We can easily bring back the right bacteria by giving them what they need, the bacterial growth factors they need, which turn out to be the 8 B vitamins that they make, and they trade them, so they need them to start off, and vitamin D. So you can easily bring your gut biome back by D level over 40 and B50. Read more about that on my website, but ultimately what you want to know is, how can this make me feel better? So once discovering these things about deficiency states that sit behind the sleep disorders, I began to use this program that I've called Right Sleep in all of my patients. So I would use it in patients who've been hospitalized with a stroke or with some other terrible thing, as well as outpatients. And one of the fascinating parts is there are many people who have sleep disorders but don't recognize it as such. They don't have insomnia. They just wake up tired, or they just have hypertension or heart disease or diabetes. And we as physicians haven't made the connection that, before the body begins to fail, no matter what the disease is, When the body starts to fail, it's because the repairs during sleep have not been complete. So we all fail from this deficiency state, but we manifest in many different ways. So you don't even have to have you don't have to know you have a sleep disorder to have one. You just have to be ill in some way that needs intervention from a doctor. And keep in mind that there are still other diseases that are not about sleep disorders. So polio is not about a sleep disorder, and measles and things like being shot with a shotgun are not about a sleep disorder. So we're talking about chronic illnesses that medicine is now treating in various ways because we failed in those ways. So any other questions about that before I continue?
No.
Okay, so one of the exciting things for me was in the first 5 years of doing this, I had CPAP devices and I had sleeping pills. Now I have something else. Now I have something that really addresses why do my young, healthy females, teenagers, kids have anything wrong with them? I don't think they should have anything wrong. I think they should wake up happy, not anxious, etc. Now, as I'm doing these vitamin treatments, I personally don't have any training in this, and I'm looking for why do my patients have these dramatic reactions to these things that we call vitamins that we treated as though they're extra. So I'm looking for the science behind it. Takes a little bit of a struggle, but ultimately what I find is when you type in pantothenic acid, what you go to is coenzyme A. It's a cofactor. And if you type in coenzyme A in the brain, so the original book that I got was about coenzyme A making cortisol. The original subject of this woman's book was rheumatoid arthritis, pain, and pantothenic acid. So if you trace down pantothenic acid, it becomes coenzyme A. Coenzyme A is used to make cortisol in the adrenal. If you type in coenzyme A in the brain, what you get is acetylcholine. Acetylcholine is a neurotransmitter. Acetylcholine is well known to be involved in our ability to fall asleep, stay asleep, transition through the phases, and get paralyzed. It is a major player in that system. Acetylcholine is also responsible for being able to focus during the day. So oddly enough, when you type in acetylcholine in the brain, what it says is acetylcholine allows us to focus and stay organized during the day. Could that mean that my kids with ADHD don't have this chemical? Yes, that's exactly what it means. So could it be that we can have not only difficulty sleeping in my child, but also trouble focusing in my child during the day, that these are two sides of the same deficiency state? So eventually we arrive at, gee, there are actually several types of acetylcholine deficiency states. Now, the weird thing is there are scientific articles about this. When I read acetylcholine, those of you that are in the lay public, that will sound like a complicated name that you don't recognize, but I'm a neurologist and I'm supposed to know this stuff. And the weird thing was I began to realize I really didn't know what acetylcholine did in the brain. And it turned out that that was because we have no drugs for acetylcholine. When I thought about it more, I thought that I really figured out what serotonin does by giving serotonin reuptake inhibitors, antidepressants. I learned about dopamine because I'm giving it to Parkinson's patients. Mm-hmm. And therefore, I thought, this is weird. I really don't know what this does in the brain. And then I start to look a little further. What has really happened in summation is when we lost our gut bacteria, we lost the only supply for making acetylcholine in the brain. When that happened, we started to see a steady increase in certain diseases that are linked to acetylcholine. And it turns out there are several, but the ones in children that are most important are developmental problems such as autism, ADHD, and in the elderly population, Alzheimer's disease and Parkinson's disease are both scientifically linked to acetylcholine deficiencies. That means this is probably something that's been always happening on our planet in old people. That as you get older, the amount of vitamin D you make on your skin for the same amount of time spent in the sun goes down. The production of D goes down. After 2 or 3 years, you've had a low D for an extended period of time. Now your bacteria have deserted you. Now you have a complex set of deficiencies that affect your sleep, and then you start to have various diseases. So it was pretty common in the 1940s, 50s, 60s that people who are rurally based didn't go to the doctor. There weren't any doctors. They didn't go to the doctor and start having medical problems till they got into their 70s. And then the things that we thought were common in old people, they lose their teeth, they start to walk funny, they start to forget, they fall asleep while you're talking to them, or they're up all night wandering around the house. Those are all things that are linked to this. And now many of those have started to present in much, much younger populations. I have an occasional patient who's lost all their teeth in the last year. Not had them pulled, they fell out.
Wow.
And their Ds are like 4, 15. So these are old diseases that were described starting in the early 1800s. Because of that, it's taken us a while to start to recognize, looking back, that these diseases that we used to present only in the elderly are moving into 40-year-olds, 30-year-olds, 10-year-olds. So there are now certain diseases where we know, like Parkinson's disease, where there's a similar disease but presenting in a 10-year-old. It's not exactly the same, but the mutation that we find in the 10-year-old, the genetic mutation that leads to that path, has led to Parkinson's disease in grandpa at age 85, in dad at age 65, and in a child, and in the next generation in dystonia at age 40. So we can sort of see that probably this cascade of D goes low, lose the microbiome, has been in the background for most chronic illness. Then when we don't sleep well and we don't have these vitamin building blocks, if we have a gene that leads to diabetes, then our pancreas starts to fail. If we have a gene that leads to heart disease, there are several. It's not as though this all leads to a single disease or that every single disease follows the same pattern. It's just that this is now another piece of information that we can use. I have another way to intercede for therapy. I'm not just giving the drug for high blood pressure. I'm actually saying, oh, high blood pressure is a reading of what your blood pressure is at this moment. Why would you have high blood pressure instead of blood pressure in the middle? It turns out that acetylcholine plays a huge role in what we call the autonomic nervous system. The autonomic nervous system is two nervous systems that are constantly sensing one another. One of them is the sympathetic nervous system, and it's called fight flight is the moniker that's used for that. They'll know about it because you get in a rear end accident, or heart rate goes up, or blood pressure goes up, we feel all anxious or shaky. That means adrenaline goes up. The other half is called rest and digest. That's the parasympathetic nervous system, and that side uses acetylcholine. Now, once I tell you that when you lose your intestinal bugs, you lose the main source of acetylcholine, that might explain why we now have 20 years documenting that many different diseases, including obviously hypertension, diabetes, post-traumatic stress, even postpartum depression, have clearly increased fight-flight. Their sympathetic nervous system is too high. Not because they are stressed, but because they actually have a deficiency state of the rest and digest side. Many of those people who have this fight flight also have belly issues. The belly issues are not just the microbiome. They are because the nervous system of the gut doesn't have its calm down side. Always has this fight flight side. So the epinephrine is high, but the acetylcholine is low. That means we can actually intervene. We can bring that blood pressure that's too high down by bringing up the rest and digest side with more acetylcholine. Now, that means another way to intervene. That means not only can we affect high blood pressure through making their sleep better with a CPAP device, but I can actually start to intervene in these deficiency states and try to add these chemicals that the body's been lacking to get me to a more medium place. My blood pressure is normal now. My body has all the ingredients it needs. And then there are several other independent diseases in neurology and, for instance, Tourette syndrome, things that we know actually respond very fast to bringing the acetylcholine up. So there are certain diseases that are really just related to acetylcholine. Oddly enough, the articles that are coming out of the scientific literature about ADHD say, gee, what we see in kids who have ADHD is their acetylcholine levels in the front part of their brain where we direct our attention are too low. Why are we giving them amphetamines? Amphetamines are not what they need. What they need is acetylcholine. And the weird part about this is we have only one drug, and that drug is nicotine. So I read these articles and I think, oh yeah, like I'm really going to convince this 32-year-old mom to give her kid a cigarette to smoke at recess so he can go through the rest of the day, because that's the chemical he's really lacking. Well, in the last few years, they've actually started using nicotine patches in autistic adults. Wow. And pretty soon they're going to start suggesting that as a more natural way to give the stimulus that's really lacking in the brain. Now, do I want you to do that? No, I don't. What I want you to do instead is say, oh, instead of using this drug, nicotine, we should use the real stuff that comes from a normal microbiome that makes B5, that actually makes it in a second-to-second continuous dose through the day and at night. The way you do that is you bring back the microbiome, and actually the vitamins are the path to bring that back. And hopefully what this will result in is, one, if we stop following the strict recommendations about keeping our children out of the sun, then we can actually, with the knowledge that burning is not good for them, we can actually put them in the sun, get them to develop their own D, not have to use any drugs. If they make their D, we bring back their microbiome once, then from then on, they run on the vitamin D they make in the summer. We start to notice what their sleep is like, and if they start having a runny nose in December, we use a little tiny bit of D between December and March and April, and then we put them out in the sun again. We slowly increase their sun exposure so that they make a tan. We don't have to worry about D levels in our children as long as we make it outside and we're careful with it. The more important intervention is getting our moms, when they're pregnant, to have normal D levels above 60. If they get their D levels so good that they sleep well, when they deliver the baby is already flipped into a day-night cycle at 30 weeks. So what you see in a normal mom who's sleeping normally was a normal D level and her microbiome is normal, you start to see infants in utero starting to have a normal sleep-wake cycle at 30 weeks. They sleep when mom sleeps, they wake when mom wakes. That means in your delivery, you've now got enough D to pass your baby D in your breast milk. Currently, the recommendation is to supplement because mom's D levels are so low. Then if your baby has enough D, he or she sleeps through the night beautifully. I have several clients who we've taken this all the way through their pregnancy and delivery, and they compare what this baby's sleep is like compared to the other two they had before that, and it's like night and day. On my website, I have several videos that are specifically tailored to this. One is called Fertility, Pregnancy, and First Year with Your Baby. The other set is for using right sleep with your children. I would rather that toddlers not have to get blood drawn, so there are approaches to that. They're watching their sleep pattern instead. Sometimes if you're trying to cure something dramatic and difficult like autism or ADD, you have to have blood levels. But if you're just thinking about your child's health, trying to do it preventatively, once you get these ideas, I think it's pretty nice to be able to say, oh, my child has a sleep disorder, i.e. he's 4 years old and he wakes up 3 times every night, comes into our bed. That is really not normal. Then you can actually use these vitamins in a gentler way that can change that, and you watch the sleep instead of the D level. So stepping back for a moment, what I'm really hoping for is we use these ideas eventually in routine medicine as prevention for these diseases. But we also have now an opportunity to affect healing in sleep, even if we don't understand the details of it. If we use every single mode that we have of treatment, CPAP mask if you have apnea, a mouth appliance if your anatomy isn't right, you use these vitamin approaches as well as sleeping pills. Anything that you have at your disposal that makes sleep better will heal your own sleep switches. One of the difficulties in the background is, it is my belief that the sleep switches themselves, if they have not been able to heal themselves in sleep, slowly get kind of frayed and rusty over time. So it's not as simple as saying, here, just give these vitamins, let's just sprinkle them on you and you'll magic dust, you'll get better. It's not like that. People who've had a sleep disorder for 20 years, we're giving them the building blocks, but if you don't get them into deep sleep, they're not able to use those building blocks to make repairs. So there's really a different concept which enlarges and says every single thing that I can figure out, whether it's over the counter or drugs or CPAP, anything that improves my sleep as an individual today will mean that my healing is better. That also means when you get to the end of this vitamin protocol, you come completely off. The only thing that you'll wind up using at the end of it will be D when you need it.
I have a question. First of all, I learned about, on your website, I read all through your articles, and I was shocked I don't think people realize the effects of D in pregnancy and how crucial it really is for brain development and the risk that low D causes to their actual pregnancy. Premature birth and all kinds of things. So I wonder, are doctors even checking D levels during pregnancy? Because the impact is huge.
It is. It's a very weird part of medicine because there are all sorts of articles all over the OBGYN literature now that says low D is related to preeclampsia. Low D is related to early delivery. The reason why we are so good in neonatology now, my grandbaby was born at 27 weeks and he is perfect. Wow. The reason why we're able to do that is it's so common. That means we can actually prevent it. There are vitamin D receptors all over the placenta that have clearly been shown to play a role in protecting that foreign invader. The baby is genetically different than mom. He's made up of two genetics that are, one of them is different than mom. That means your immune system can attack that baby and lead to miscarriage and lead to early delivery that leads to the baby's death. If we get the D level into a safe range, and it doesn't even have to be in the range that I'm discussing, 60 to 80, there is plenty of literature clinically that if you bring the D level over 40 and you keep it there, that's the piece, not the dose, it's the blood level. You bring it above 40 and keep it there, your incidence of all the complications of pregnancy are really reduced. There's another piece in the background, though, that I think is just as important. All of the malformations of babies that have to do with central bonding, so cleft lip, cleft palate during development, these developmental things happen in the first 8 weeks of development of the fetus. So they're even before we really know we're pregnant some of the time. So difficulties and malformations of the face or the nervous system where they don't fuse in the back are all B vitamin deficiencies. That means they are happening in a mom who does not have a normal microbiome. Unfortunately, the prenatal vitamins do not have enough to really offset this. And they're incomplete. They don't give all 8. People give folate, the OBGYNs give folate. They know that vitamin deficiencies are in the background, but they don't understand the bigger concept that if you have a normal microbiome, you can actually have 12 infants that live to adulthood over a period of 15 years. That's an amazing accomplishment. It's so easy to fix this. I have one client who recently contacted me who did in vitro fertilization, and they put that embryo into her body, and she doesn't have B's, and that infant had meningomyelocele and would have been paralyzed. So she had the pregnancy aborted. Now, I think that's easily avoided. I think that this is actually a public health issue. There are plenty of scientific articles that support that. D is a very odd, conflicted scientific area with lots of misinformation. So there are areas on my site where I address that for you. If you want to learn more, you can come on my site and learn about that. And I'll be writing more blogs about that for people who are more interested in the depth. Most of us just wanted to have, just tell me what to do. Okay. The most important thing to do is it's never safe to take D without doing your levels. You must do the blood level. It's like every other hormone. The second thing is if you start taking D for any reason, you should always add B50 and always do that for only 3 months and stop it. And then following that, if you keep your D above 40, you don't even have to be real accurate about it. You just have to keep it above 40. Make sure you don't go too high. So you may want to take it just in the winter, not in the summer. Do your levels 2 or 3 times a year. You keep it above 40, your bugs will never leave you again. You'll be safe. They're not that picky. If you want to cure a sleep disorder, That takes a little more attention and is a little more detailed. But if you just want to get your bugs healthy again, really a D over 40 and B50 for 3 months, that's all there is to it.
Well, a couple things. Is the reason, I mean, everybody seems to be low in D. Is the reason because we're not out in the sun? I mean, most of us are indoor all day long. And, you know, back in the day before we had phones and screen, I mean, people were just outside, they were with nature. We weren't checking D levels. We weren't supplementing. So why are so many people deficient, and especially in kids? And also, I would love you to just kind of describe why D itself is so different than other vitamins. What is it doing for us? How is it functioning in our body? That's, you know, without it, we're having all these problems.
Excellent questions. Thank you very much. The first is back in the 80s when the dermatologists said that being in the sun was bad for us. Unfortunately, there was already a huge body of literature suggesting that D did hundreds of other things, that it affects every organ in the body. But because this is an odd story. The guy who put this story all together that said D is the master hormone. It has never been a vitamin. That was a mistake. It was never supposed to be, it was never a vitamin. It was always a hormone. It was made on our skin. The reason why it was called a vitamin was because we were looking for a vitamin. We, at the time in the 1930s and 40s, we were looking for something in the food that would change rickets. There had already been descriptions that if you put kids with rickets out in the sun, their leg pain and malformation would go away. So we already knew that it was sun-linked, but there was an exploration into, is there a vitamin that comes in food that would change rickets, that would change a bone disorder in children? They use rats to study this. Rats don't go out in the sun. They're nocturnal. The way they became nocturnal, and they have a very, very important niche where if I can become nocturnal, I can sneak around in your house and eat your food. I can sneak around in the bottom of ships. I can eat the wheat. I can eat the food that's stored there. Rats love humans. Oddly, we hate them. We hate them because they creep us out because they're in our house with us. If they stayed outside, we wouldn't really care. But we really don't like them. The reason why we don't like them is the same reason why we are willing to torture them in little experiments. That's why we use rats and mice in experimental scientific studies. But in this particular use, what they found was rats can use D2 that's made by yeast or fungus that grows on the food. They can therefore isolate this chemical that's really on the food, but it's really not from the wheat itself. It's from a fungus that grows on the wheat and makes this chemical. They therefore said this is a vitamin, it comes from food. 10 years later, somebody finds a different chemical called D3 on the skin of pigs that were left out in the sun. The unique thing about pigs and humans is we're bald. When you think about it, there are very few other animals that are completely bald. Pigs and us, that's it. Unless we breed something weird like a bald cat. All other animals make D in their fur or in their feathers or on their scales, and they lick themselves to get the D. It is not absorbed directly. It's quite possible that we, when we were naked, overcame the Neanderthals that were furry because it gave us an advantage to have this much skin that was exposed to the sun. That's my hypothesis. But so it turns out 10 years later, this other chemical called D3 is found on the skin. Because it was already discovered as D2, they then compared D3 in all the studies. D3 took a second seat to D2. The weirdest thing of all is D2 is still given out by prescription. The family practice recommendation, American Academy of Family Practice, still recommends that for osteoporosis or for low D, you give D2, which is not made by any animal. Insects, birds, mammals, reptiles, all they make D3, all of them. That means the only thing that ever made D2 was yeast and fungus, which came millions of years ago, was a very early form. we're giving this form that is not meant to be in humans, not meant to be in any animal, still today as a prescription. So ultimately, until you ask a little bit more, what does D do? Well, it's not just about bones. There are receptors all over the brain. It really determines the blood-brain barrier. It is heavily involved in protecting the brain from our own white blood cells sneaking in there and attacking. D is heavily involved in the immune system. D is involved in our mood. That's why we feel better when we go out in the sun. That's why our animals lay in the sun, because D makes us feel better. Why would that happen? To encourage animals to get this hormone that runs every other hormone. Back in the late 70s, early 80s, Walter Stump wrote an entire conceptual framework for understanding D. He was an endocrinologist, neurologist, scientist. He was very, very interested in hormones. All of his work was in hormone receptors. Very early into this, he said, if there are vitamin D receptors throughout the GI tract, in the brain, in all of the reproductive organs, that means that this hormone is the boss that runs all the lesser hormones that run fertility, metabolism, and hibernation. So it runs our sleep. So when I called this guy up after the clinical observation that I had, that their sleep got better, he said, no one's ever written about that, but that makes perfect sense. You know, you have my articles there showing you that the sleep switches are covered with this vitamin D. The reason why animals hibernate in the winter and have certain other things that come along, if you bear your babies when it's freezing cold and you don't go into a den like the bears do, where you're protected, those babies are going to die. So in each species, D plays a role in their fertility, where it happens through the year. So springtime is where birds are fertile. That means they have a whole summer where there's food available for them. So their linkage to D will start to kick in and make them fertile in the spring. We take 9 months. We have 9 months gestation. That means that we become most fertile in the fall. Our D goes up as we're exposed to the sun. In October, our D is at its highest. Both male and female fertility are linked to this. We mate in October and our baby is then born in June. So single species has adjusted this. This chemical was there for millions of years with the dinosaurs. This is extraordinarily old. The dinosaurs slept like us. The dinosaurs had to find a way to recognize who their competitors were, how to find food. They had to teach their children. That means they had to sleep. Their children had to sleep to develop. All of these same processes are identical in the dinosaur as they are to us. And then here comes the human scientist and medicine and says, why don't we just give D2? We know nothing, yet we give strong recommendations. So Walter Stump had already described that this was the master hormone that let animals of all kinds on our planet go towards the north and south of the planet where there was winter and summer. He gave that concept, but he was also very smart and very arrogant, and his other colleagues at the vitamin D workshops didn't really like him. They thought he was too arrogant and they would not accept his viewpoint. That means my first entry, my first step into vitamin D is into his articles, and it makes so much sense. There were so many things going wrong with my patients. They have reflux. Oh, could that be related to D? These are all young, healthy females. They have gallbladder disease, they have thyroid disease, and they have reflux. Could those all be directly related to D? Yeah, directly, not with any microbiome support, just directly D. That means if you get into this concept, you can then trace all these different diseases. There are multiple mechanisms. Now, what's happened is from the 1940s until now, okay, so we have like 80 years of basic science research. In the last 40 years, there's been an epidemic of low D. So Walter Stump starts writing his articles right at the beginning of the 80s. We had no epidemic at that time. There were no sleep disorders. Kids weren't depressed. What we have to really think about is medical people and drug companies make drugs for things that show up. They really only want a product that's going to be bought. That means you look in the background and you say, well, what if these things didn't show up? What if nobody was depressed? Would they make antidepressants? No. If nobody delivered their kid, 10, 20, 12 weeks early, They wouldn't know about neonatology. Medicine only responds to the things that walk in the door. If nobody has a complaint that I've got this purple horn growing out of my forehead, there are no drugs for that, okay? That's a different way to look at stuff. Then you say, instead of saying, oh, it's the toxins in our environment, it's that we don't eat right. Yes, those are all important things to investigate. But the other way to look at it is, if the human population between 1940, after World War II, and the 1980s, was actually able to live into their 70s, and we didn't have polio, and we didn't have scarlet fever, and we didn't have measles, we'd actually gotten really good with immunizations. They were successful. Our population in the US was the most healthy it had ever been. They did not have a grocery store. Most of rural America canned their own food. That means they didn't have fresh food that we're assuming is the core of health. What they really had was really hard work. They had to till the soil, and they had to be outdoors all day. Mm-hmm. So to swing back to your question, when the dermatologists in the 1980s came up with sunscreen, it's not that they're wrong. It's that the other doctors who should have been standing next to them, the endocrinologists, me as a neurologist, if there are D receptors all over the brain, how come I didn't learn that? How come I didn't learn this in endocrinology in medical school? I didn't learn it because humans really are focused on status, and medicine is still focused on status themselves. There is this odd disconnect where we're thinking we're dealing with truths. We're not. We're dealing with, I published a paper. Do my other colleagues accept that paper? There's still this status, tribalness in medicine. That means Walter's ideas have been overlooked. They're very clear. He's done over 300 articles. Now, we've now moved into a time, so if those of us are standing next to the dermatologist, would have been able to say, yes, it's nice to use sunscreen. It allows us to go out without burning, but we have to use it within an intelligent setting so that our kids won't be vitamin D deficient, because here's the other 100 things that D does, okay? D and sleep is a late arrival. I was the first person to write that as a clinical observation. There are multiple other clinical observations slightly before and since then in single case reports. The problem is that actually having a clinical trial, so medicine is now moving into times when it's going to say, I want you to take this group, give them this drug, quote unquote, hormone, give them this hormone. I want to take this group, don't give it to them. They are still doing, the great majority, 99% of the studies are still give 5,000, give 2,000, give 10,000. It doesn't work that way. You have to follow their levels. You have to adjust their levels. You have to think of it like a hormone. It was never a vitamin. So even the really intelligent journal articles are using the techniques done in other journal articles, which are wrong. There are clearly a bunch of authors who are writing that this is an incorrect way to study this hormone. That means that we as the lay public are suffering from things that we need to intercede in now, okay? Mm-hmm. I'm not interested in being famous. I'm interested in these ideas getting out to the lay public because my lack of success in getting my colleagues, even people who used to think I was smart, can't get it. As soon as the vitamin word comes out of my mouth, they roll their eyes and go, she's gone wacko. Mm-hmm. Vitamins are chemicals like any other pharmaceutical. They have an important role to play. And it turns out vitamin B5 is extraordinarily powerful stuff. And vitamin D, that's really not a vitamin, is a hormone and is also extraordinarily powerful. The thing that I'm really offering that I want you to get out of this webinar is that D by itself can be potentially dangerous. Mm-hmm. D plus Bs equals a normal microbiome, and keeping that as a system approach, not a vitamin recipe, but the idea, I bring back my microbiome, I watch for that to happen, I stop the B50 at 3 months, brings back an organ of the body that then contributes to our health in a million ways. D by itself has hundreds of applications. So you asked what it does for us. It is heavily involved in the immune system. It is heavily involved in how the bacteria talk to the inside lining of the intestine. So there are now, and the last time I looked at this, which was about three years ago, there were 65,000 articles about vitamin D. The last 35,000, so that's since the the 1940s, 35,000 in the 5 years before. Like there has been an explosive growth in the primary research in animals and in a petri dish about what D does. And basically it interacts with every system. There are vitamin D receptors in the islet cells of the pancreas that make insulin. There are vitamin D receptors all through the GI tract. That means it's linked to our fertility, it's linked to our metabolism in multiple ways. And the piece that has been left out is that all of the literature we have now about the microbiome, that the microbiome is what makes us fat. If we have the wrong guys, we get fat. The microbiome is heavily involved in our immune system. The microbiome talks to our brain. It's heavily involved in Parkinson's. It's playing a role in every chronic illness. The piece that's been left out that has just really started to have scientific articles that underpin it. In 2016, I published a hypothesis that was D was a major trophic factor to the bugs. D by itself did not bring them back. That's really important. But D plus B50 did bring them back. That means we have to link the production of the bees. That actually showed that D was playing a huge role in why we all have IBS and all have autoimmunity. That is now being underpinned by clinical trials that show when you lower the D intake or raise it, you change the species that live in the belly. That's been done in humans for the first time in 2020. So now there's a buildup of articles that make this connection. So D does a million things. I'm not even telling you half, a small percentage. Plus, the more important piece is there are probably hundreds of effects of this chemical that we don't even know yet. That means we're throwing it around. I'm trying to encourage you to use your head, to be cautious, to apply what you're learning on my site and in other sites, to think about what's happening in your body in a bigger way. I'm just going to take this vitamin and forget about it. Very dangerous. You don't want to do that. You really want to do levels. You want to learn a little bit more about it. I really appreciate that people want to be healthy. But frankly, someone who's very healthy, who has no problems, should not be dabbling in D. You're adding a hormone. It's like, I'm completely healthy. Why don't I just go take some thyroid hormone? That's not the right approach.